Hi, my name is Steve Schmidbauer. I'm the Executive Director of Child Family Health International, otherwise known as CFHI. What CFHI is really looking at is ways to work to improve primary health care at the grassroots level. And in order to do that, we find local health professionals in the countries who are already dedicated to their own underserved communities, and we just try to assist them and support them in their work. Our founder is Evelyn Jones, who was at Stanford University as a student. Now she's there as a professor, and she's also our president. And we kind of are very much, I think, still carrying out her vision. Her vision was not only that people should be going to underserved communities to help, but she really wanted to go to be able to learn from the people in the underserved communities. What kind of wisdom is there in that community? What can that community teach us? What can that culture teach us that's different that we don't even know about yet? So part of our values really are that we are looking at working in a strengths-based way. And in order to do that, we find points of strength in the communities and we build on those. And operationally, a way that we do that is we do a strengths assessment or asset mapping as tools instead of doing a needs assessment, which is characteristically done everywhere else. I think, it's sort of one of those things that we don't even think about, and I think it's important, especially in these days when at this conference here in Ottawa, we're talking a lot about equity. And so to think about equity not only in terms of access to health care for people individually, but to think about equity in how we run our programs, how we set up relationships, how we engage with communities at the local level is really very important. So to use needs assessment consistently is something that really only focuses communities primarily on what they don't have instead of what they do have. And if you do a needs assessment after needs assessment after needs assessment in a community, you end up building up, I think, a dependency. People are looking at what they don't have and they're looking outside to fill what they don't have. If you do a strengths assessment, you're really finding strengths in the local community and you're really trying to build on those strengths. So it actually takes a little bit more work in the beginning. It's a little bit tedious, if you will, because for me personally, it's easier for me to tell you about my weaknesses than it is about my strengths, and communities are the same way. So we train our people to identify strengths, to look for strengths, and so to be able to build on that instead of just looking at what the community doesn't have really changes the dynamic of interaction. Part of the strengths assessment is asset mapping. So look at what are the assets in the community and getting the community then to participate in this exercise of identifying the strengths. And pretty soon, once you start identifying strengths, then it's an easy process for people to get into, but they don't sort of default to that. And so once you've really started that, then you can build on those points of strength. So for instance, with CFHI, we find a local medical director who is either a doctor or nurse practitioner in the community who's dedicated and committed to that community. And then we work with them for a while. We design a global health immersion program with them, and we bring international students so they get that exchange. We build this relationship with them. And as part of that relationship that we're building, we're saying to that physician or that nurse practitioner, what are ways that we could really be of assistance to this community? Where are the points where a little bit of help could really go a long way? And it's amazing what they come up with, very, very concrete, small interventions, but interventions that make a real difference in the life of people. So for us, it's, I don't know, you've heard of microfinance and micro lending. I suppose this is micro global health, if you will. And it's ways that are very real and tangible and really benefit local communities. And it can be anything. It can be getting the proper supplies and equipment to the right location, to the right clinic, to the right hospital. It can be doing a small community health project that really works on a problem that's in the community. Or it could be providing professional development for the local health workforce to improve their skills to serve their own population. So for students who want to get involved in a CFHI program, a way that you can do that is to go to our website, which is www.cfhi.org. for Child Family Health International. We have an online application process because students are coming to us from all over, from the US, from Canada, Europe, Australia, New Zealand, all over. And we're really most interested in what your motivation is for going on a program like this. So we want you to have done some homework. We want you to really think about your role as you see yourself in your career and your profession, and what this experience will do for you in terms of helping to prepare you for that. And then as part of that, we also really look for what are your personal goals for being on the program. So what's your motivation and what are your goals? And we invite students to write about that because we really are looking for what your way of thinking is. We're looking for signs. Here's the cheat sheet for you. We're really looking for stuff in your writing that shows that you're going to be respectful to a local community, that shows that you're going to be respectful to a local culture, and that shows that you're really open to differences of opinion, differences of understanding, and really looking to learn. That's the most important thing. As I mentioned before, we have preceptors who are local healthcare professionals in the communities where students are going, and those health professionals take this very seriously. And so for students who are going with an attitude of really wanting to learn, then those health professionals respond and they just open right up, and it's a wealth of information you can't get in a textbook, you can't get any other way than by really listening to somebody who's done this their whole life. And when you can sit with a doctor who sees a patient and sees a whole series of patients, and then you can ask them the question, why did you think that? Why did you think this? What happened in your mind? What do you know about the culture? What do you know about what this woman is going to go home to that made you think about this question that you asked? Those kinds of things that happen through experience that are signs and symbols of a local expert who really understands the conditions at the community level are things that will benefit you because you can transpose those jumps that doctor made in their own assessment of a patient. You can transpose that into any other culture that you go into by really being astute and picking up what they're doing. I think for students who want to get more involved in global health, it is important for you to really do as much reading and research as you possibly can. If there's a particular country or particular area of the world or a particular part of the health equation that interests you, then it's really important to get as much information as you can to understand that your perspective is going to be changed by this experience. So you want to prepare yourself for that. I think a lot of times students are going because they have this great feeling that they want to change the world, they want to help the world, and that's really admirable and that's really great. But I think once you get into it, you're going to see that there's a huge backdrop here. There's so much going on. There's actually so much more for you to learn than there is for you to actually do, initially at least. And so to prepare yourself to have things not always go the way you think they're going to go, to be open to new and different experiences. And I think the most important thing that I find is that it's important for students not to have any kind of judgmental attitude about things, and to really be open to that new and different way of thinking that is completely foreign to you. And that will be a way that you're not only professionally you will be able to develop in a greater capacity, but personally it will open you up to things that you've never thought of before.